1.
Boris, we talked about some questions that sometimes family members have for their children with bipolar disorder. Some of the other questions that we get is that if we're not really sure that my child has a bipolar disorder, how important is it to start with medication? Are there some other things that can be done instead?
Yes, definitely. If you can, there are many types of therapies, and then you can do family therapy, individual therapy, group therapy. You can change the structure of the kid. You can do accommodations at school. And also, everything depends how severe the symptoms are and how the symptoms are impairing the functioning of the child. If the child, for example, is very violent, aggressive, or psychotic, or wants to hurt himself or herself, then sometimes you cannot wait too long. If you, for example, think that the adolescent is extremely depressed and they cannot cooperate in psychotherapy, you can opt to use medications as your first choice, and then when the adolescent is beginning to do better, then you can add psychotherapy and whatever has some evidence working. But yes, you don't have, if you are not sure that the child is bipolar, you don't have to run, one, for the diagnosis, and second, for any medication treatment.
One of the things that we get sometimes from families is that a child has been tried on several medications. If you're working with a kid and they've been on 2 or 3 different medication trials, is there something that you do at that point different than you would if they, obviously they've done better on one, you would have continued that? Where do you go from there if things aren't?
The first thing that we do usually is, one, to see if the trials were appropriate. Second, if the dose of the medication that was used was appropriate for the good duration of time, but also the dose, if it was good. If the child developed side effects, if they really took the medication, the adherence was good or not. And then if we think that the trial with the medications were appropriate, and they are not working, then why the child is going to continue with them? Then what we do is to stop everything and observe the child and restart all over. And usually what we restart is, again, the diagnosis. We usually meet with the parent, the child, sometimes we invite teachers or therapists, and we brainstorm together. As a big family, we go again through the symptoms, against the longitudinal outcome, what's going on, in order to be sure about the diagnosis before we are going to, again, blindly begin to prescribe new things.
Okay. Well, thank you very much.
You're welcome.
That'll be very helpful.
Okay.